Hey family, and welcome back. I know it's been a minute, but today we've got a great topic for you. And it's something I've been asked a lot and have just been having lots of discussions with different people throughout the city. And that is, what are the things you should be looking for in your primary care physician? Okay. And this was my topic of my last radio show. If you're in Las Vegas, I am on KCEP 88.1 FM every first Wednesday of the month at 10 a.m. Wellness Wednesdays with Dr. Jade. But the topic was, what are the top 6 things that you should be looking for in a primary care physician? So I thought our YouTube family would also want to see that. And so let's go through it. We'll go through them pretty quickly. There's 6 things, and they're the things that you should be looking for. Ready? Here we go. Number 1, accessibility, you guys. How accessible is your doctor? And that looks like, when you need them, can you reach them? When you need them, can you get an appointment? How accessible are they? So these are the things you should be asking yourself or looking for. Looking for if you don't have a doctor already, a primary care physician already, and the things that you should be thinking about if you already have a primary care physician and be evaluating if it's time to make a change or not, okay? The second thing, so number 1 was accessibility. The second thing is continuity. And that looks like, can you see the same physician every single visit? And that's really difficult these days in our healthcare system, unfortunately, with how the insurance companies have forced us to stack patients on top of each other back to back to back. Don't get me started, but you want to be looking at, are you forced? And forced meaning, the only way to see someone when you need them is to see someone different, every visit? Or do you have that continuity where every visit, your doctor is available for an appointment with you when you need them, okay? Do you have that continuity? Number 3 is flexibility. How flexible and convenient are the options? We live in the age where Amazon brings a box right to our door. We can get our groceries delivered to our house. We are in a convenience era of life, and your doctor's office should be no different. You should have those options, right? So can you come into a beautiful office like Inspire Primary Care, or can you also, be seen via video visit or via a telephone visit, or even higher level, communication, quote unquote, and even text or email your doctor directly, okay? Are those options of flexibility there or not? Number 4 is quality. How much quality do you have in your care? And when you look at that, it's like, first of all, during your appointment, is it rushed, or, are these 8-minute visits impersonal where the doctor is staring at the computer screen? Or is it like an unrushed environment and it's a conversation between your doctor, like talking to a family member, and do you have to wait in the waiting room a long time? And, what does that quality experience look like? And that's important, because if the quality is poor, then you're probably not going to see your doctor as often as you should. So how is the quality for your primary care physician experience? That's another thing you should be asking yourself. Number 5 is efficiency. How efficient is that experience? Oh my goodness. I don't like to wait a whole long time. And I'm sure when you're sick, especially, or you have a health concern, or you just want to be, get your screening and be responsible, right? And check in with your doctor on how your health is going. You don't want it to be a hassle. And so what is the efficiency like? Are you waiting in the waiting room for an hour plus or not? How does that look? Because again, if you're waiting around, you have to take a full day off of work every time you have a question. It's a hassle. You're probably not going to see your doctor as often as you should. So you should be asking yourself, what is the efficiency like? What is your overall experience like when you're seeing your primary care physician? And number 6 is an important one that's not talked about enough, in my opinion. And that is, what is your physician's medical approach? And again, when you're seeing physicians in the traditional healthcare system that's insurance-based, most of the time there are time restraints on that visit placed by the insurance companies. And so that has this rushed experience, get them in, get them out as fast as possible. And when you have that, those parameters and those guidelines, oftentimes you either have to give a pill or change the medication, give a new medication, or do an unnecessary referral of something that could have been handled in your office. It delays care, all these things that many of us experience, right? And so that is what I call a sick care approach, where I'm not getting down to the root cause of what's going on. I'm not truly listening to you to say, how's your sleep? How's your nutrition? How is your stress? What's going on in your life, in addition to, are there any medical conditions tied to what's going on, right? And so when you look at that sick care approach versus that wellness or health care approach, you want to be thinking about, what is the philosophy that your physician, your primary care physician, is following in the office? And so now I'm going to tell you how we are doing all those things different and how we're solving those problems at Inspire Primary Care, for example, so you can know, that these problems don't have to exist, and there are better ways to do healthcare. There are better solutions out there, and Inspire Primary Care in the Las Vegas area is one of those amazing options. So how we solve the problems here, let's talk about accessibility first. All of my members have my cell phone number, first of all. They can directly text me when they have questions. They can directly email me when they have questions, and they have their own scheduling link, and they easily self-schedule themselves. They see my calendar. They're able to jump on my calendar. We have easy accessibility to appointments. And I always have urgent care, same day, next day slots available for urgent matters as well. So very easy and accessible when it comes to my patients being able to reach me when they need me, right? So that's the first way we solve that problem. And then continuity, seeing the same doctor every visit. All of my members see Dr. Jade every single visit. They don't have to worry about retelling their story or, seeing someone that doesn't know them. That doesn't happen here at Inspire Primary Care. And then 3 was flexibility. So very flexible. We have in person at our office. We have, video visit options, phone call options. On that self-scheduling link for our members, they simply select if they want to come in the office or video or phone call. And it's just that simple. And because they have my cell phone number, they also can, just text me if they have a question, or just email me if they have a question. So super flexible, right? The number 4 was quality, guys. And so we do quality by having unrushed 60-minute visits, by getting feedback from our members on how can we make your experience better, by having a newsletter where we're checking in with them and giving them updates and giving them wellness tips. And, just so you know, we do have a newsletter for everybody, and then we have a members-only newsletter that goes out as well. So if you want to join our newsletter, if you want more information on Inspire Primary Care or just different health and wellness tips, and you want to stay in contact with us, go to our website at inspireprimarycare.com. We spell it without the I in the front, so NSPIRE primarycare.com. And there you will see at the bottom, you can join our newsletter. So you can join our newsletter and get those amazing updates as well. And so that's another way we keep it quality, because we're in constant, trying to provide value and build value into our membership, okay? And so then efficiency. Oh, I am the efficiency queen. That was number 5. I am all about efficiency. To me, my waiting room is decoration, all right? It's just there to be pretty. But when my members arrive for their visits, I am very it's very important to me to not waste my members' time, just like I don't want my time wasted. So our appointments start on time. They simply text me. They have my number, so they text me when they get here and say, I'm in the lobby. And guess what? I walk out and I get them, bring them back to the office, and we start their appointment. So there's no delays, there's no hassle, there's no paperwork they have to fill out, there's no, nurse that calls them back. I do the vitals right here at the table, and we chat and we figure out what needs to happen. We do over here on this side, we chit chat, and on the other side behind me, we do medical evaluations, and over there in the cabinet or any, equipment that we may need for procedures, which are also included in their membership. So it's efficient, you guys. It is efficient. And so then the last thing is medical approach. And, a separate business of mine is my wellness coaching business. And I have my Inspired Health Method that looks at the 7 aspects of wellness and helps our members and non-members transition to their ultimate level of health. And so my medical approach is truly healthcare approach. I look at your overall wellness. I follow the lifestyle medicine training, specialty training sleeping. And so when I look at that, I'm looking at, okay, I'm not just going to give you a pill. I need to know what the root cause is. How are you sleeping? What is your stress like? What are you eating? How often are you moving? What are your relationships looking like? What are all these other areas of your health and wellness looking like that are also contributing, in addition to using the medical brain, right? We have the wellness brain, and then we have the medical brain that's looking at, okay, well, is there an actual diagnosis attached to this? And let me investigate that as well. But not just going straight to that and straight to a pill. That's very important, okay? So that's how we approach it with a healthcare approach, not a sick care approach. And to me, a sick care approach is just, here's a pill and here's a referral, and hopefully you can see a specialist in 3 to 6 months. So hopefully that answers for you, what are the 6 things that you should be looking for in a primary care physician? Let me know if this was helpful. Let me know what you learned, or if you have any other questions on things you want me to share on the channel. We will be, shifting the channel to more, primary care. Health, wellness is always going to be built in, but I really want to share with you guys what it's like to have quality primary care. If you're in the Las Vegas area, that is definitely with Inspire Primary Care. And if you're not in the Las Vegas area, but you're interested in joining a practice like mine, which is a membership practice, we follow the direct primary care practice because we don't bill insurance in our practice and instead do a membership. I'll do a separate video on this, but because we do the membership model, we're able to add that quality care that I just explained to you. If we, build insurance, then we would have to do it the way that we discussed with those 6 things that you don't want to experience, right? Rushed, impersonal visits, difficult to get appointment, et cetera, et cetera, et cetera. So if you're looking for a practice like mine, but you're not in the Las Vegas area, you can go to the DPC Frontier website. You just put in Google DPC Mapper, MAPPER, and then you'll see that it'll take you to that website. And there's a whole map. There's over 1,600 practices like this across the country, physician-owned practices that are giving this type of quality care. You put your zip code in and it'll pop up all the ones in your area. So how cool is that? So if you're in the Las Vegas area, or you know anyone in the Las Vegas area looking for quality care, we are now enrolling members at inspireprimarycare.com. We will be capping our patients. Originally, we were saying at 600, but we might cap our patients around 400 to 600. We're kind of leaving it in that range for now. So if you know somebody who's interested in joining, please have them join before we are full, before our enrollment period is closed, because then there will be a wait list, okay? So if you have any questions, inspireprimarycare.com, the contact me page comes straight to me. And also join our social media families if you haven't. Thank you for being here on YouTube, but we are on Instagram all the time at inspireprimarycare.com and at Dr. Jade MD. So meet me there too. All right, see you guys later. Bye.